the time I was in cardiology, so I chose cardiology, but my aunt had MS, so I wanted to learn about neurology. So that's where my neurology interest started over 30 years, 40 years ago. And so I've been in the MS space for 25, 30 years, and I've been in the Parkinson space for about 6 years. And I always used to kid my MS patients that my hand was sitting on my shoulder because I used to sit in her lap when she had MS. And my mother was her sister, and she never said her name. My Uncle Charles took care of her. I never heard her say his name. From my early age of 8 until I was 21 when she passed, every time I walked in her door, I'd sit on her knee, and she always knew me by name. And so it always, to this day, as you can tell, still resonates with me that, and her husband would even say, none of us could understand why. I had brothers and sisters, never said their names. Why she picked me out, we still to this day never knew why. Maybe I was a troublemaker. I don't know. Maybe that's what it was, you know. So we're going to talk today about Parkinson's, and we're going to talk about a new product. The one thing I want to let you all know, and I mean this from the bottom of my heart, and Bob knows this, be your own advocate. And I mean that sincerely. If Inbrija is for you, great. If it's not for you, great. You know, what I want you to do as a Parkinson's patient is don't ever let a physician tell you that you can't have a normal life or that you can't do the things you want to do, because you can. You really can. If you want to be that patient to go to rock steady boxing and to be active and to do a lot of things, yes, it's probably more challenging for you, but you still can do a lot of things you want to do. And I will tell you, because you know, we're only a week from Thanksgiving, and I had a lady last week when I was in Nashville 2 weeks ago, and she said to me that her husband comes and sits down, he has Parkinson's, for their Thanksgiving dinner. And she says, but he rarely stays with the family. And I said to her, I said, what do you mean he rarely stays with the family? She goes, well, his hand tremors a little bit, and it seems like it tremors more when the family shows up and he's eating Thanksgiving dinner. So he'll leave the table because he's kind of embarrassed, and he'll go sit by himself. And I said to her, I said, we got to change this. You know, that's not fair to him, and it's not fair to your family. And so I will tell you, if I have any one proud moment, is the people that use Inbrija and use it right, and Bob knows it takes some effort. You know, I used to say it was easy, and I've learned now through people like Bob and other people that I'd tell physicians now when they prescribe Inbrija, if your patient's not willing to try it at least 3 times, don't even give them a sample, because I've learned the first time they try it and hell it and work with it, it probably won't be done right. Second time, it's probably done a little bit better. The third time, they go, wow, this is really making a difference. So we're going to kind of zip through the slides because I don't want to bore you a lot with just managing Parkinson's and the treatment of Parkinson's disease. We all know the importance of empowerment. I just talked about that. You know, talk to your healthcare provider. That's critical. I've got a thing here, which is a new questionnaire we come out with to talk to your providers about. I'm going to hope to get your doctors to actually take some of these questions. When I was in the MS space, we had an MSWS 12, which were 12 questions patients were critical to answer before every doctor's appointment, and the doctor could look through those questions and really learn a lot about a patient very quickly. So what I'm going to try to do with this is get some of the physicians, say, take some of these questions, some of your own, and before you even room that patient, let them answer those questions, because you may find out a lot very quickly right there and go for it. So I'm not going to spend a lot of time on what Parkinson's is. You all know what it is. It's the reduction of dopamine, and that's what Levodopa does. Staying active is very important. We've already talked about rock steady boxing, so it falls right in theme with what all your doctors are going to prescribe and what you feel like you need. The goal of Parkinson's therapy is just to control your symptoms. And the one thing I'll tell you, and I'm going to use this analogy a lot, and actually Tom Davis told me he was going to start stealing it from me because he liked it. You'll start to know that everybody will tell Parkinson's patients that every Parkinson's patient is different, which is factual because you all have different symptoms and it goes different ways. I analogize it to a car, and the reason I do that is because there's Ford, Chevy, Chrysler. They're all different brands, Lexus. They all have different gadgets and different symptoms like you do in Parkinson's, but they all have 4 tires. They all have a gas tank. So Parkinson's patients do have a lot of symptoms and course of disease that's very similar. But like a car, they also have very different things that go on. In addition to that, if you think about the gas tank for a Parkinson's patient, that's your Cinemet, that's your maintenance dose. I tell everybody, your car doesn't go anywhere if you don't have gas in it. Just like you don't go anywhere if you don't take your maintenance medication. So I tell everybody, if you're on it 4 or 5 times a day, don't miss a dose. My drug is not intended to replace your maintenance therapy. You need that gasoline. Think of this product more like kind of a jump start when you're needing it, and it gets to work as soon as 10 minutes, which we'll get to that. So this talks about different therapies. On and off periods, this always, to me, is I don't know why the medical community came up with the word on and off because I think it confuses patients. You know, I mean, off obviously is when your medication is not working, and on, I always try to think about like a light switch. If you turn a light switch off, it's dark in here, so your medication isn't working. And on means that your symptom control is doing well. So I always use the green light and red light a lot, and then the yellow's kind of in the middle. So I try to teach my doctors that. They don't always keep up with me, which is kind of interesting. Despite regular dosing, what you're going to see is you see this all the time. This is not an Inbrija patient, just so you know that. I say this a lot of the times, that an Inbrija patient, this is a patient completely off therapy or completely frozen. I'm not saying Inbrija can't work there, because it possibly could, but it's really not intended for there. It's really intended for right in here, the yellow or bottom of the green. Before you go, I always use the roller coaster and say, before you get to the bottom of the dip of the roller coaster, when you go over the crest and start to go down, that's when you really should use your Inbrija, you know, and start to use it. So you see, I use a lot of analogies, because I think you remember stuff better. I do.
Yeah.
These are the signs and symptoms that are motor and non-motor. Understand that Inbrija is only indicated for motor function, because that's what we tested it. The reason people test things on motor function, because you can measure it. Okay, it's measurable. Non-motor function things like anxiety, mood changes, drowsiness, confusion, anxiety, stress, those are the triggers of Parkinson's disease. But I always try to teach Parkinson's patients, because they think, well, when I get anxious because my family's going to show up, it's when I start my tremor, or when whatever. Do you know what? If you had diabetes, you know what diabetic patients do? Their blood sugar goes up. If you have blood pressure issues, you know what blood pressure patients do? Their blood pressure goes up. So I always say that anxiety and stress is not unique to Parkinson's patients. All patients that have a disorder of some sort, anxiety and stress normally makes that disease worse. It just does. It's just the nature of, you know, I always say it's the nature of our body a little bit. Return of symptoms can happen anytime during the day. It varies a lot. This is the number one thing as a patient. And I'm beginning to teach my doctors now about the paradigm shift, because doctors are so used to giving patients pills. An inhaler, my little inhaler is just different. So they're not always thinking about that, if you will. You know, and the one thing, if you don't learn anything else from me today, no matter what pill you take, whether it's for blood pressure, Parkinson's, or whatever, when you take that pill, it's not going to work for 45 minutes. And what happens for Parkinson's patients is when they get feeling bad, or more importantly, the Thanksgiving dinner is going to happen at noon. And I don't know about you or me, but you know, you're getting ready and you're getting excited about Thanksgiving dinner at 12:30. Well, all of a sudden, that's when your Parkinson's gets bad. I had a gentleman tell me the other day, he said, you know, it's really weird. My wife and I go out on Friday nights. He said, I go in and literally changing my nicer slacks and shirts when we go to dinner. My Parkinson's has been under control all day. I feel great.
Yeah.
The minute I put my dress shirt on to go out with my wife, my Parkinson's clicks in.
Yeah.
And we're supposed to meet friends, literally, the story he told me, said, we're supposed to meet friends in a restaurant 20 minutes. It's right around the corner from the house. And he said, and all of a sudden, I look a mess. That was his comment. I look a mess. I said, well, I'm sure you look a mess because you're putting your dress shirt on. Because I felt a mess, you know. And so that's all the more reason to use Inbrija, because it's the only product out there that gets to work in 10 minutes. You know, if you took another pill hoping that it would work, it wouldn't work for 45 minutes. So it's probably not going to help you. By that time, you've already had to cancel your dinner reservation. You've had to cancel your dinner plans. So sudden return and unpredictable returns of off or symptom return happens to Parkinson's patients more than they realize, and a lot more than physicians realize. I will tell you that. These are just people describing their return of symptoms. You know, standing up, my feet won't work, I'm uncomfortable, you know, my hands shake, you know, all the things people say they, you know, people think they're drunk when they're really not. This is Inbrija, what we're going to talk about today, and I've just realized it's really unusual for me not to have my Inbrija held around my neck. But today I was trying to get AV together, so I was more worried about that. But we'll talk about it. If we need to, I can go out in the car and get one real quick. Inbrija is prescribed for the use when needed for off episodes for patients taking carbidopa levodopa. Okay, and it's just a light portable device. Everybody I've talked to likes it because if they're with their spouse, they can stick it in their pocket, they can stick it in their purse. It's very light and portable. You know, do not use Inbrija if you're taking old MAOB inhibitors, but those are old antipsychotics and old antidepressants that docs don't need prescribed anymore. If you don't remember anything else about Inbrija, this is the key slide to go home with today, really. Gets to work in 10 minutes. It starts to have symptom relief in 30 minutes. and it lasts for up to an hour. Now this is what we call a SPAN PD clinical study. I have physicians challenge me all the time that use it now in the office, say, oh, Byron, it gets to work quicker in 10 minutes. Well, it might. Lasts longer than an hour. It might. You know, it just depends on your metabolism. Everybody's metabolism is different. This is how the drug works. It actually gets in your lungs, bloodstream, and brain within 10 minutes or less, is what we say. It's kind of a unique delivery system. And I'm sure you've heard this in so many Parkinson's lectures, you can't stand it. This is what happens with carbidopa levodopa. It goes to your gut. I tell everybody all the time, because I have a pharmacology background, we all take a lot of pills for blood pressure, for all this stuff. The gut is the most inefficient system to put our pills in. It just is. The reason all companies put them in pill form is because it's inexpensive and it's cheap and it's easier. You know, he knows this because Bob's heard the story about the little kazoo, as I call it. The little blue inhaler has a lot of technology behind it, like 20 years of technology behind it. It just didn't come out overnight, you know. And so, and it's very, very unique. Nothing else will work in the inhaler other than an Inbrija capsule. I get asked all the time, because it looks like a capsule. If I swallow the capsule and forget to put it in my inhaler, will it hurt me? I'm like, no, it won't hurt you, but it won't help you because it won't work, you know. But this is what slows down, and it's protein binding. And I had even a lady at one of my meetings one time who was a healthcare professional that dealt in nutrition, and she wanted to challenge me, oh, I'm really managing my protein. And so I don't have those ups and downs. And I said, well, God bless you. You're the first Parkinson's patient I've ever met that can manage your protein and do this. I couldn't even do it. You know, I mean, it's protein bound. So that's the other reason. And I hear patients do this all the time. They'll take their 4 doses and they're having a bad day or they're having something bad, and they want to take a half tablet, which makes sense. I mean, I understand why they want to do it. I would tell you that probably works maybe 25% of the time, because what's happened is let's say it was your 4th dose a day or your 3rd dose of the day, it's stuck in your GI tract. That's why you're probably having the off symptom. It's not completely metabolized. Now what you do is you throw another half tab on top of the one that's already there that's not metabolized, and you may all of a sudden get a huge burst of dopamine from your carbidopa levodopa in 4 hours, because maybe they finally both metabolized because of what you ate that day. So just keep that in mind. This slide has a lot of graphs on it, so I usually go through this pretty quick. This is just talking about the oral carbidopa levodopa, and the return of symptoms happen all the time. And as you can see, it's all over the board as far as when your drug kicks in. These are the things that you need to talk to your healthcare provider. Obviously, because it's an inhaled medication, if you have pulmonary disease or you're a bad asthmatic, I was talking to a doctor yesterday, I wouldn't recommend it because it actually goes through your lungs. One of the things I'm very compelled to tell you, because I understand with COVID and everything else, everybody's worried about their lungs, and you should be worried about your lungs. We all should have been worried about your lungs long before COVID. We should have worried about it when our parents were smoking 6 packs a day. I don't mean that to be mean, but it's true, you know. And I will tell you, they studied Inbrija and did pulmonary studies for 5 years, a large group of patients. And I'm a study nerd, so I actually pulled the smokers out because there were smokers in the group. And there was no lung damage whatsoever to any of you. You couldn't tell the difference in the people that were on the active Inbrija and the people that were not. So I don't worry about your lungs taking Inbrija at all. Matter of fact, it's probably safe. It's probably the safest thing people have ever put in their lungs in their lives. Actually, when you look at the clinical trials, you know, it's something you need to be concerned about, and it's something we put up there that if you had asthma, I wouldn't take Inbrija, obviously, because your lungs are already compromised.
Now, I was going to say, have there been studies that like if you do have asthma and you take this, does it affect your asthma?
You know, it can potentially make it worse because it's using that lung capacity to metabolize the drug.
Oh, okay.
So it could. You know, I've got to be careful because I've heard of what I call a light asthmatic.
Yeah.
Who's used it and had success with it.
Yeah.
I would even be cautious with that. Just because I'm a pretty cautious person.
Yeah.
You know.
Okay.
And the one thing I would tell you, and all these other side effects and things that are out here, the nausea and whatever, I laugh because if you look at my side, carbidopa levodopa is one of the most nauseous drugs out there. It just is. It's just the way it's made. If you look at the Cinemat, don't quote me exactly on this because I don't have the package insert out, but it's pretty close to 25 to 30% nausea for carbidopa levodopa for Cinemat. Mine is 8 versus 5%, so it's like a 3% greater. And when I first started promoting the drugs, doctors would say, well, it can't be levodopa, it makes everybody sick. And I'm like, but you don't understand it. That all comes from the GI. it bypasses that. That's why you don't have the GI upset, is because we're on lungs, bloodstream, brain, so you don't have that problem. So, but the rest of these side effects you're gonna see with the cinnamon, they're no different. Inbrija should be used at the first sign of off. I talked to you earlier, in the yellow zone, as I call it. You know, don't wait till you're way down here before you decide to use your Inbrija. It's not intended to replace a maintenance dose. That's not its intention. Think about your specific return of symptoms when you use Inbrija. And we may ask Bob, if he doesn't mind here in a minute, to talk to us about his use and how it's going for him. 98% of the patients can use the little device, okay? I get asked that question a lot. And I will tell you, when I first launched the medication, because of this statistic, I probably minimalized the use of the device. I've now learned in 3 years, like I said before, you need to try it 3 or 4 times, but you'll get it down. You'll figure out how to do it. And so far, I've not had a patient that I've met that's been on Inbrija that says it's not worth it. I mean, one of my attorney ladies, her comment, I did her support group, and she stood beside me and she says, I'm using this. Byron says you won't cough much. I'll tell you a cough every single time you take it. And so I'm like, well, she's a patient. She knows, not me, you know. And I've heard some patients say I don't cough too much with it. So I think it depends on the patient. But the ability to use the device, once you learn to use it, Bob, do you think it's difficult, really?
Well, no, not at all. But I've learned, I stumbled across the way to inhale it, where I don't cough. I used to cough every time, but what I do, I actually cough first, and I just clear my throat, and then I inhale it. And for some reason, that coughing first, and then needing to breathe after coughing,
Alleviates that.
yeah, it just takes your mind off of the fact that you're inhaling that powder.
Yeah.
And it works. It's like, well, there's the answer, because that's the one thing that everybody will comment when we talk about it. It's like, well, I don't like it. I choke when I inhale this or whatever, and so they give up on it. And they say, well, I can't take it because I can't.
And you did choke in the beginning.
Oh, I did. I totally did.
So,
And
but now it's doing great.
yeah, and it does work. Mine maybe 15 minutes, maybe not 10 minutes, but everybody's different.
Everybody's different? No.
And I'm happy with that, because it's like, but and if you're right. I should take it when you feel the first signs of going down, because sometimes I've waited until
You're down.
rock bottom,
Yeah.
and it's like, well, then it's a desperate need for anything that will alleviate.
Yeah, you're so bad at that point. Whatever I get a hold of, I'm gonna try it.
And I have just recently even, still the stomach problems I have had. Last Sunday we went to, Sunday, to at the Jewish Center, a big sale that they had, running sale, and I really wanted to go in, but as soon as I took that medication, I did it on a heavy empty stomach. I took my morning vacation.
Your pills.
My pills, about 9 of them that I take, and something was not right, because and this happens just every so often. I think it is the levodopa, where I just have an upset stomach.
From
and
the pills.
I
Yeah.
just have dry heaves, because I have nothing in my stomach. I probably didn't eat breakfast first, and that's probably, I think, why it happened. I didn't have any
But you
breakfast.
never get that.
Oh, no, I never
Do
had
this.
this.
Yeah. Yeah, but I would tell you, Bob, you're right. I try to encourage all people with my pharmacology background to eat before you.
Yeah.
Even my wife, she'll get up early in the morning, she's got a regimen of pills. I'm like, honey, do you eat your breakfast yet? No. Go eat a little breakfast
Yeah, that's
before you take
Nikki's
pills.
always trying to get me to eat, but it's time management.
Sure it is.
Yeah, no matter what it is, whether it's multivitamins, supplements, medications,
Right.
Even if it's just a small little something, even if it's a couple bites of banana,
Yeah.
that makes a big
Right.
difference.
Right.
Because like with even myself, I take, I can take a whole handful, and I think about 14 at one time.
Right.
Of supplements and medication, but I know I will delay taking them if I haven't had anything yet, because that nausea that even hits with me
Yeah.
and on just supplements is extreme, and it's because they will, once they disperse, they will hit back.
Right.
Yeah,
pretty
they'll
hard.
come back to you.
And then also that coughing that you do before, that's kind of as an asthmatic, with the inhaler, that's a kind
No
of
trick, is it?
trick, yeah.
Okay.
And
It
so
is.
anytime that you have an inhaler, whether it's the Inbrija, asthma inhaler, albuterol, or anything, that should be a thing that, you know,
I
they
think
should
that-
tell people
yeah,
more.
they should,
yes.
I think it's been almost like a thing. It's been told so much that I think people forget to even do it now. 'Cause I think
Right,
they think people know it. But yeah, doing that coughing before you inhale, it makes a world of difference
Yeah.
because what it does, it expands the lungs
Yeah.
and it gets it ready to
Right.
to inhale more
To
air.
accept that,
Yeah.
to accept that
Yeah.
medication. What I wanna do, this will be my last slide, which is Inbrija.com is available. I've given you these brochures, all the telephone numbers and everything for prescription support services is there as well. So we have, and have continued to improve our support services over the 3 years I've been here. I went to a meeting last week in Denver, and we have a nursing service that if you have problems inhaling or any kind of problems, you can call and ask to speak to a nurse, and she's a registered nurse, and the average nurse call with the patient is 45 minutes. So I always think that's pretty neat to think, and she'll Zoom with you if that's what you want to do to show you how to use the device, if you've forgotten how to use it. So support services are really helpful.